Hi there. For this edition of Nobody Told Me That, I'm actually going to play two of my favorite clips from my other podcast, Chew on This. I'm not sure if you've listened to that one, but it is a very fun podcast. And we're going to talk about a new law in Minnesota where assistants can do anesthesia. And then we're going to talk about dentistry in space, which is something that usually is not a topic of conversation. But can you imagine? So I wanted to go ahead and share these two clips with you. I hope that you like them. And if it's something that you are really laughing about, feel free to check out Chew on This on wherever you listen to this podcast.
Teresa, I'm up a little higher today than normal, up in beautiful Breckenridge, Colorado at 9,000 feet. But you know, some would say that's high, but I bet, as Creed would say, you could take me higher.
Oh my gosh. You went like classic rock elevator music type reference there. So, dear listeners, you know how we are known for taking you on adventures along with us. We're going to take you to space today.
Ooh.
So I actually, and again, Kevin, I have to say this article, very, very interesting. Cannot wait to link it in the show notes. And I am going to go ahead and share the screen because honestly, it's just amazing. You know, it's just wild because look, listeners, we go to the journal Curious, which is actually spelled Cureus. So, you know, very clever there. What am I talking about? We're going to space. We're going to space. Okay, so this article here, I'm so excited. This article is called Smile Beyond the Stars, a narrative review exploring the challenges for dentistry in space. So for all of you who are thinking about, you know, I probably could add another location onto our practice, let me give you the pros and cons of whether or not you can go to space. So operating a practice in space, the pros, we don't have a tax system up there yet. So pretty much everything is yours. That's what I like. Cons, yeah, lots of cons.
Yes, I'm thinking of a few right now. Yes, absolutely.
First of all, travel, parking is really bad. So I'll tell you that. Like, you know, how do you find the space? You got to circle the planet a couple times. No, but seriously, this article actually, Kevin, this like spoke to the geek in me because what this did, the authors took a look at the effects of being in space on existing dental work and on the oral cavity. So if you are living in space, imagine that you have gone to space on, you know, SpaceX, right? So Elon Musk got you to pay some money. You went up into the stars and you're like, ooh, why is my tooth hurting? And then you land on some Mars colony and then you're like, oh, wow, there's only one dentist in the area. This kind of stinks. How are your teeth going to react? So again, this is just super cool. So here's what.
You know, that dentist is out of network. That's the worst thing, right? I
mean, totally out of network. Total fee for service. Yeah, it's terrible. So you got to pay like in moon rocks and stuff like that. So what are the effects of space on teeth? So some of this is kind of scary, you guys, because what it does is your body is subject to microgravity. So what this means is that like it's not just gravity, it's microgravity, meaning like even on like a micro level, you've got gravitational forces because when you're in the spaceship, there is some gravity, right? Like they have the gravity machine that's in there, but for the most part, you're not subject to gravity. So the problem is that your body and bodily fluids work on gravity. And so this is the problem here. You don't have the same salivary flow, Kevin, which I know you're very concerned with. And so
that's why I get drinks. I'm telling you. Yes,
exactly.
Absolutely.
You got to keep that going. And in fact, I think on our last episode, we talked about things you shouldn't know, like mistakes we make. And one of them is after you drink something acidic, you should chew gum. Remember that?
That's right. Yes, I do.
And it was to get the salivary flow going. So what happens when you don't have a lot of saliva going around? Here is basically the issue. And for those of you who are audio only, we've got a big chart up that lists a couple different conditions, which I'll go into, not ad nauseum, just touch on it a little bit. So you basically have decrease in salivary flow rate, which then allows for a higher bacterial load because some bacteria likes it when there's not a lot of saliva there. And likes it when it's anaerobic too. So you got a higher risk of caries, higher bacterial load, which then is going to lead to higher incidences of periodontal disease and, of course, your cavities. So then that leads to overall compromised immunity. The increased risk of odontocrexis, which was a totally new word for me, and we're going to get to that in a second.
Oh, good.
I know, vocabulary time. But here's what's really wild. When your body doesn't have the salivary flow and the blood flow, so the blood flow, when you have bone, like our bodies are full of bone, your blood continually flushes your bone with cells that break down bone, but also create more bone. Okay. If you don't have the creating bone cells, then you have a decrease in bone level. So that's why you lose bone, osteoporosis. So when you go, there's been studies, and I know this just from being a woman and worried about osteoporosis, like astronauts have a higher incidence of osteoporosis because of this. They actually lose bone mass. Well, for your jaw, which is two bones like coming together, you can actually have a decrease in the temporomandibular joint. Like that could actually be compromised and get smaller. Now, I think you'd have to be up there for a long time, but that's kind of scary, Kevin, that whole thing.
Yeah, there's a lot of things, about space that I'm not thrilled about. And after hearing you talk about this, I'm like, I'm probably good. I'm probably A-okay. Yeah.
Yeah. So, I mean, if I gave you a birthday present of going to space, you'd probably be like, nah, I'm good.
If it's one of those things that because I know there's a certain atmospheric level that you can get to, and technically you're in space, and I'll be like, okay, I'll do that. Just get me up that much. Perfect.
But I don't even know if you want to do that, because
talk to me.
Odontocrexis, which is spelled ODO. NTO, okay, odonto, and then crexis is CREXIS. For those of you who are listening to this audio only, it's on the screen if you're on video. Odontocrexis is awful, Kevin. Refers to the phenomenon where pre-existing dental restorations, such as fillings or crowns, may fail when exposed to high altitude environments. I mean, you're sitting in Breckenridge right now, like at any moment, you could have...
My fillings just fly out. That's just how quick it'll happen.
This is in the article. You're going to die. It actually says there's unintentional expansion of gases trapped beneath your restorations. Okay.
Oh, geez.
Do you have crowns and fillings? Do you have any crowns and fillings?
I do. Yes.
Oh,
yes,
boy,
I
we're in
do.
trouble.
So,
okay.
Yeah. So, see? Wow.
Well, our editor is going to have to remove any gore that happens on the screen. If
all
this
sorts
happens
of
here.
gases just going out.
The increased pressure, Kevin, can lead to what is colloquially known as tooth explosion, where the restoration is forcefully dislodged from the tooth due to gas expansion. Okay, this is a thing. I'm not making this up. Tooth explosion. So when exposed to high altitude, pre-existing leaky restoration. So if your dentist is terrible, Kevin, if you got a bad dentist and got these leaky restorations, or if you've got recurrent decay going on under there, it might induce a tooth explosion due to the inadvertent expansion. I mean, when is there an inadvertent expansion of gas trapped behind the restorations, right? So I'm just saying... Okay, so you and I fly a lot.
Yeah.
What happens? What happens if you hear a little next to you?
The 14-hour flight to South Africa, I'm very curious now. I'm a little nervous. Maybe I should stop over a couple of times. Make sure that I don't have tooth explosion before I go speak at the dental meeting there.
This is terrifying. I mean, honestly, I was like, ooh, teeth in space. I can't wait to read it, right? And then this, I wish I had never read the word odontocrexis, because it's terrifying. So I have a crown, and I have, I think, 2 fillings in there. I do not need this. This is not on my bucket list of things to enjoy in my life.
I'm going back to that fee-for-service dentist that's on the moon or Mars or where we were a few minutes ago. Because he or she's probably got it pressurized there in the dental office, and you're good. Right. But the minute you walk out, tooth explosion. If they didn't do it properly, you don't have to wonder. It's like, oh, yeah, they missed a spot.
So you know how some dentists, after they do a root canal, because also there was an effect on root canals. I'll talk about that in a second. You do a root canal, you do a crown, you take an x-ray just to make sure everything's seated and everything looks good. Well, instead of taking an x-ray, you just go, hey, go out, walk outside. Just walk outside for a second.
No, I missed something. Sorry. Come on back in. Yeah. And now we're going to have to start over. Plus, I got to rebuild your jaw. But other than that, it's going to be great.
Dr. Henry, we have a problem.
There's where you don't want to be the dental assistant. Is it right there? It's like, sack it, dog. Now I got to rebuild this.
I love it. Because when you say tooth explosion, I'm thinking explosion, but it really wouldn't be an explosion. It would be more like a pop. Yeah. And usually when I hear a pop on a plane, it's because the guy next to me did something that I'm going to feel like about a couple minutes later, right? Like I'm going to experience a couple minutes later.
That's invertent gas. See,
that's
what that is.
Noxious invertent gas. So, which is why most women will carry a scarf on the plane because of things like this. We go total like face covering. I don't know what you guys do. Do you guys just go, "Oh, buddy, what do you do?"
I always just point at the other people and go, "Oh, dude," but.
Do you do the thing where did your dad ever used to say, "Did you see that mouse? That elephant? Did you see that elephant across the floor?" Like
no, let's hear this. What?
Yeah, no, like, when he would,
oh, got it.
Erupt, have his own explosion, so to say.
No, always blame the dog though. Always blame the dog.
He did that too.
Always blame the dog.
He'd always just go, "Oh, did you see that mouse? That's a big mouse." What? So if any of you have little kids, go ahead and blame it on mice, and that'll keep them busy, because then I would go and look for this small elephant or mouse, whatever he decided to say. And that would probably take up about 20 minutes. So actually really smart in hindsight that I would go looking for this thing. I love that. Yeah, right. And how stupid am I that I'm looking for something that emits inverted noxious gas? All right. So, and then the other piece, so let's talk about endo, because this is also, the thing is, when you do a root canal, you got to really seal all those roots. Like there could be like a micro space, right? Like this really scares me. So at any rate, the cements that they use, basically they are subject to micro-leakage, which is another word I didn't want to know either. And that is prone to failure under simulated space conditions because of the pressure fluctuations. And now so they also had oral surgery considerations, because basically, as you mentioned, but in the pregame, going underwater, like it subjects you to a lot of pressure, barometric pressure. Going high altitude, the same thing. So with oral surgery, you would also have issues with the sinus area. Like if you did an oral surgery and you extracted and it went into the sinuses, now you got to worry about that. I'm going to give you another vocabulary word here, Kevin. Are you ready?
Okay, bring it.
This may be the most educational edition of Chew on This ever. Barodontalgia. Ooh. Barodontalgia is a toothache caused by a variation in barometric pressure. Okay. So The pain is sharp or squeezing in nature. So it also occurs on ascending and descending. So during a flight, it's associated with vital pulp tissue. So if you're going up and you have this toothache, your tooth is alive, but it's hurting. And on descent, it's associated with pulp necrosis, which is your tooth is pretty much dead, dying. That's wild. Yeah, that's really, I never knew that. So it's really wild. Okay, so basically, if anything pops when you're up in the air, that's the tooth explosion. But if anybody like totally screams in pain, that's barodontalgia in ascend and descend. I'm telling you, I learned so much with this article. I can't wait for you all to read it. And basically, we are going to have to innovate if we are indeed going to have space colonies. We're going to have to innovate and make sure that we can, in all seriousness, handle the decreased saliva, the micro-leakages, all of the technology, all of the materials that we use right now. A lot of the people, the sales reps will tell you, there's zero leakage and everything. Oh, yeah. If you're not telling the truth, if your rep is embellishing, people's teeth are going to explode.
So how soon until a Kettenbach or a Shofu or a GC or somebody says safe enough for space? And that's their whole tagline. And
you know what? I would consider that the gold standard. Ooh. So I would say to my dear employer, is that crown, like if I went to space tomorrow, would that crown be okay? And if he looks at me like the dog, like with a question, like, what? Huh? I gotta choose a new dentist. Yeah. I'm just kidding. I'm
dropping that one. Next time I go in, I'm going to be like, I'm thinking about going up to Skylab. I just want to make sure, and I know Skylab still isn't up there. I don't want to hear any nasty comments from listeners. So
listen,
I know.
So is there another specialty then for space dentistry? That's another consideration.
Yeah, space endo. I mean, yeah. I mean, seriously, you got to think about space wisdom teeth.
So listen, if you go to battle and you're in the military, right? And you go off to battle, you've got
Okay.
to have your teeth checked out to make sure you don't have like an impending doom on one of them, like a root
Don't
canal
want
that's
that.
ready to burst, right? I
Yeah.
mean, seriously, we live near Fort Belvoir. We used to like sign off on that stuff all the time. And that's something that like if you go to space, now I'm wondering like on Cape Canaveral or at SpaceX, like before the astronauts go up, what is the dental like what is that? What do they look at it? Can you only have virgin teeth, right? Like,
Wow.
I mean,
Sorry, you
good
can't
luck.
you can't go to space because you have a root canal up. So sorry.
See,
Wow.
see
Things to
that
think about.
Laffy Taffy you loved in high school?
Came back to
You're
haunt you,
out.
didn't it? Laffy
So,
taffy.
so yeah, dear listeners, I mean, I don't think I'm going to space in my lifetime ever.
No.
So, if any of you are so inclined and you do make it to space, circle back to us because we'd like to hear what's going on with those chompers, the space chompers.
I just wonder, are our grandkids going to go to space? Or what generation will be like, oh, yeah, we've got a colony up there now? It's just fascinating to think about, seriously.
Yeah, like instead of Mardi Gras in New Orleans, it's Mars de Gras, like, right? Like we're going to
Oh,
Mars. Ooh.
look at you. See?
Yeah, but do you remember when Julia started driving and
Oh,
when
yeah.
Noah started driving? Like they would go out at night, right? And I would say, I kind of want to know where you're going, but I kind of don't. So, like, if they do go to Mars or wherever, I don't know if I want to know. Like, just tell me
Yeah.
you're going to Myrtle Beach or something.
Mars, Myrtle Beach, both start
Just
with M. It's fine. It's
don't
fine.
post anything until you get home and I know you're like on the ground because if I find out you went to space and didn't tell me, I'm going to lose my mind a little bit.
Why is your Instagram from Mars? I'm just curious right now.
What's this location? What crater is this?
Exactly.
What is that? Just a reminder to check out the companies who support the show. My friends at Synergy Dental Partners are offering 2 free months to try out their lower prices for labs, supplies, and select software services. To sign up, visit odysseymgmt.com/synergy, and the link is also in the show notes.
Going on up in Minnesota, and I will be honest, this is one that you kind of brought up to the front, is that there are some changes going on. We're talking about the nervousness of teens with dental injections, with dental anesthesia, and we are now at the point when the state of Minnesota where dental assistants will be allowed to give some injections. And
With some caveats, though.
with some caveats, which I'm definitely going to run through here. So I'm reading this directly from minnesota.gov or mn.gov. We'll link to this as well, just so that you'll see what I'm reading. But dental assistants in the state of Minnesota, and I'm reading direct quotes here. Before administering local anesthesia, a licensed dental assistant must provide the board evidence of at least 1 year of experience in general chairside dental assisting, evidence of completing a board-approved didactic and clinical course at a school accredited by the Commission on Dental Accreditation that requires clinical competency in the admission of local anesthesia, evidence of passing a board-approved, nationally recognized local anesthetic examination, and evidence of application for local anesthesia certification through the board. So, as you and I were talking about before we came on the air, and I'm a huge proponent for dental assistants and what they can do in the practice, but this, according to Minnesota, 1 year of experience plus completing these various courses, all these different exams, everything else, and you are set in Minnesota to place some anesthetics.
Yeah. Usually you and I agreed on this. We are big fans of assistants, very undersung heroes in the office for sure. But this gives me pause. I am referencing back to your study. People are already nervous enough about getting a shot, right? And so now say I'm an assistant and I meet the criteria, I take the class, and I want to talk about the class in just a second. You've been seeing me chairside as a patient. You've been seeing me chairside. You've been seeing me clean a room, all this kind of stuff. And now like I'm coming at you in a nice, gentle way with a needle, right? I don't know as a patient, are some patients going to get freaked out, or will patients do what patients do and just not notice that anything's weird? So for me, I would notice it, but most patients, I don't know if they would.
But I'm also going to flip it, because one thing that I always talk about with my dental assistants whenever I'm out there is how much they're trusted by the patient, how much that they are often seen as the equal. So is it something that, because they're trusted, could the dental assistant, could that lower the stress level with the patients? I don't know. I mean, it's a two-sided coin. I'm not really sure. And I know everyone is different, but I would be curious to know about that.
That's a great point. You're absolutely right. And as a former dental assistant a gazillion years ago, I always was impressed with my doctor's technique on giving injections. He was always really good at talking them through it. And, he hid the needle until the last minute. They really didn't even see it. So I think good assistants are probably going to mimic that and be able to use those tones. And they are mostly they're the ones who comfort the patients anyway. So, that's a great point. That's a great point. Some of the objections that I've read online, because some of the Facebook group, as are predicted, were not necessarily welcoming of this, the dentist heavy Facebook groups. And even some assistants I saw pipe in and say, we don't want this, but let's talk about that in a second. They were very angry and bringing up the fact that they had to take years and years of anatomy and physiology. And then, because you've got to know about the interactions, the acid and the base, and the, and the anesthetic with the body. I'm just going by the little I know, you have to know that stuff. And then they have to take lots of classes. And so really they're feeling like, one class, which we'll go over what's included in that class. One class should not be enough. Right. So I don't know. I'm torn, because also there's not a lot of, hygienists are, so basically, I'm assuming that in Minnesota, hygienists can give anesthetic, because honestly, if the assistants can do it and the hygienists can't, that's crazy. But you and I didn't look into that. So
No.
Caveat there. But I know in the states where hygienists can give anesthetic, it's such a helpful thing for the offices. Honestly, in our office in Virginia, our hygienist gave more injections most of the time than the doctors did. She was just always free, and he was going back and forth.
And that's a really good point, because we talk about the short staffing in today's practice. We talk about all these different things that people need to be cross-trained in. And often that's the front versus the back whenever we talk about cross-training. But this is something, Minnesota has always been very progressive whenever it comes to their dental assistants. It's one of the reasons why the dental assistants in Minnesota are always either number one or number two whenever I look at the average pay per hour for dental assistants. It's always Minnesota right up there at the top. And also, if you look at, and one thing that I do is I look every year at, there's a study that comes out from USA Today about the healthiest states in the United States. Minnesota is always up there as well. So I think that there's some kind of relationship between that, between oral health, overall health, what dental assistants can do. But this is a big step, and I think it's one that is definitely going to be taken care of. A lot of people focused on what happens here and can it happen in our state. And I think a lot of people will sit back and watch that.
Well, I wanted to very quickly here, if I could, just go over like what it is that's included, just because I think that would be very handy for us to kind of go over with the audience. And we're not going to do a full thing of all of the classes and stuff. Okay, so it's a 45-hour training program. The University of Minnesota already has it up and open for registration. So 25 hours of didactic instruction, so recorded and Zoom and reading Quizlets and worksheet. That's not in person, I guess. It doesn't seem like it. And so introduction to local anesthesia, there's the recorded lecture, reading assignments. So there's pharmacology and neurophysiology, which this is the issue. I know you know this probably, but just for people who maybe are newer to dentistry or haven't been assisting very long, there are definitely cases where it takes a long time for a patient to get numb. And a lot of times that's because there's an active infection or it's the patient's makeup. Like some people just take forever to get numb.
Absolutely.
I was talking to a friend of ours who actually just had a root canal, I'll tell you afterwards. And he said that he has this thing where they actually don't, he might have to just go get numb because they put so much anesthetic in him. And he keeps telling them, look, my body makeup, this has like been proven, and they never believe him. If you keep giving too much injections, it can be too much for the body. But if the infections are very acidic, Kevin. So that's the nature of that's what's going on in your body is when you have an infection, there's a lot of acidity there. And so you have the anesthetic is basic, right? So that's supposed to cancel it out. But sometimes if there's too much, you have to just keep injecting and injecting and injecting. And that can cause problems with the whole body, the whole system. And
Right.
so then you need to give them something to counteract that. If you're having actually an issue, you have to do some buffering there. That's something that I know my doctor was always like, oof, we're not, you know what, I'm not taking any chances here. You're not getting numb. I'm sending you to a specialist because you get into a lot of risk. And that was something that was brought up on the Facebook groups, is who's carrying the liability here. It's always going to be
Right.
the doctor, even if the assistant has it, right? Okay, so they go over complications management. And then part B, at home or workplace clinic 5 hours. This makes me nervous. It's the injection experience. And for these assignments, it says, it's right here in the thing, you will need to borrow a syringe, cartridge, and needle from your place of employment. Participants must also purchase 1 bone-in piece of chicken. I'm a little nervous that that's anywhere in a dental school curriculum, right? Okay, so let's keep going. Then 15 hours of on-campus hands-on injection. Okay, that makes me a lot better, right? So you're practicing at home. And to be fair, implant dentists practice on pigs' heads. So, pig's head, bone-in
Oh,
chicken.
yeah.
Whatever.
Absolutely.
And then let me see here. Then there's, I guess, a test, and then they wrap it up. So I guess they wrap it up. I'm not seeing an exam, actually, now that I'm thinking. I don't see an exam on here, Kevin. It looks like it's just a training program. Okay, so that's a little weird too. Okay, so all that being said, it sounds like it's a very intensive program. I think it was like $3,000 for that, and I'm sure employers are going to pay for that, which is fine.
Of course.
It does add to the skill level, but I don't know. It's so new. I'm just having a hard time with it.
I think with everything, there's a lot of risk. And I think, you mentioned the doctor's license. The dental assistant will now have more responsibility in the practice, but he or she will also have more risk involved as well. And so I think that is something that you'll need to figure out. If you're an assistant, do you want that risk? If you're a practice, do you want that risk? I know this, like I said earlier, this is going to be watched, and good, bad, whatever, it's going to be watched by other states. I'm all for dental assistants being able to progress their careers, try new things, but I'm very worried about they have to be like, the training has to be so in place and so spot on. And whenever I was reading a minute ago, let me just go back to that because it really struck out to me. The evidence of passing a board-approved, nationally recognized local anesthetic examination. We know that there are going to be a lot of choices for that out there. Some are going to be better than others. That's what concerns me a little bit, is
That's
the level of that exam actually being passed, where that comes from.
Very interesting. Well, and one other issue too that we saw when in the readings, and I should have mentioned this too, is that there's 3 different kinds of anesthetic that I'm familiar with. And one is the nerve back here, which affects the lower jaw. And basically, if you've ever had a nerve block, it numbs your whole jaw. So it's one shot up by the nerve, kind of. And for those people who are not clinical, it's just kind of where your jaw comes together, where it articulates up by the ear. So the nerve block there, and then that numbs your whole lower. Then you have on the upper and anywhere in the lower, like this infiltration where you just kind of go directly to the tooth. And then there's what they call a field block, which is where it's on the lowers. It's not the nerve block where everything's blocked on that side. It's like basically sprinkling anesthetic over a larger field. Okay. The nerve block is not included in this legislation. That is one of the first things I looked at. Remember in the pregame, I was like, block, wait, block. And then when it said field block, that made a lot more sense. So nerve block is where all of the legislation, that's where all the legalities, the suits and everything.
For sure.
Because if you get that wrong, there's permanent nerve damage and people lose feeling, all that kind of stuff. One lady, I remember one case, she lost feeling completely and it affected some sort of saliva gland over here too. And she had constant drooling. And I can't even imagine. At least there's no nerve blocks, I guess, where I'm feeling a little bit better.
One of my grandpa's favorite sayings always comes up: with choices come consequences. Good or bad consequences, there's still consequences. So if this is something that you want to have in your practice, I think you've really got to think through all of the what ifs. And you've really got to be prepared to explain maybe to patients, yes, Dr. Smith normally does this, but now Teresa is able to do this, and isn't that wonderful? And Teresa's been trained, and really, while they may trust Teresa to be an assistant, really make sure that they understand that Teresa's taking her career to the next step. And kudos for that. I love that part. But I think that there's going to need to be a lot of patient education in there as well about how much that Teresa has trained and absolutely this is safe and all that.
Yeah, I feel like we're kind of in a brave new world. I was not surprised when hygienists got the ability to do anesthesia. And some people argue, well, they only had 2 years of school. So really, what's the difference? But I feel like it's a different level. I mean, there's a lot more focus on that. But, we've met some rock star assistants. So we will be watching this carefully. I know Dr. Bicuspid's going to be covering some stuff on that too. So we'll keep you informed here. So that being said, Kevin, next time I see you, you want to let me practice on you? I've got some mad clinical skills.
I've heard your tales of dental assisting, and I love you dearly. But I think I'm going to pass this time. I think I'm just going to go eat my chicken wings, and I'll be okay. So
how dare you?
I know.
That's probably the smartest thing you're going to say all month because Kevin knows I have stories. I was a terrible dental assistant. It was bad. So luckily, my doctor realized that I could be used elsewhere. So whenever I hear people talk about you got to put people in the right seats on the bus, boy, I was in the worst seat possible. It was terrible. So God bless my old boss.
We're all super busy, so thank you for making time for me today. The show notes will have any links that we referenced in the episode. You can also find links for my book, events, and my online insurance course, Dental Insurance Design and Management. I speak often around the country on management and insurance issues. Come hang out with me in one of my classes. I promise you'll laugh and learn.